Today, we are going to talk about unmet needs in modern medicine, and this is especially in relation to the chronic diseases and the burden of incurability. We know that chronic diseases account for significant proportion of the global morbidity and mortality, which means significant chunk of the disease burden and deaths. We also know that most of these diseases are due to gaps in the biomedical research and therapeutic innovation missing. So, we are going to talk today about limitation of the modern medicine in addressing the chronic conditions, emphasizing the profound physical, psychological, and socioeconomic impact on the patients. And we will try to discuss the current evidence and the urgent need for multidisciplinary approach to bridge this gap and mitigate the patient's suffering. When we talk about the chronic diseases, diabetes, Alzheimer disease, rheumatoid arthritis, cystic fibrosis, etc., affect over 1.7 billion people worldwide. And despite advancement in the diagnostics and the symptom management, curative therapies remain elusive or almost absent for most chronic conditions. And this lack of the definitive treatment is responsible for patient suffering, poor quality of life, and strain on the healthcare system. And these strains on the healthcare system may be in terms of the cost and resources. We will therefore try and explore the gaps in the modern medicine contributing to this crisis and their repercussions on the patients. The first, we are going to talk about the biomedical research gaps and also gaps in the therapeutic development. And we are going to tackle about the incomplete understanding of the pathophysiology of these chronic diseases. And this is due to the complex interactions between the genetic, environmental, and immunological factors. For example, the precise mechanisms driving this autoimmune diseases, multiple sclerosis, for example, is very poorly understood, and therefore this hinder the targeted therapy development for these diseases. Similarly, other neurodegenerative diseases like Alzheimer's are characterized by the heterogeneous pathologies and that defy the singular therapeutic approach managing these conditions. Second, we are going to talk about limitations in the current therapeutics. So, most treatments for the chronic diseases focus on the symptom suppression rather than addressing root causes. For example, insulin therapy in diabetes manages hyperglycemia, but it does not restore the pancreatic beta cell function. Similarly, immunosuppressants in rheumatoid arthritis carry risk of severe side effects, including the infections. Let's talk about the underinvestment in the rare complex diseases. For example, amyotrophic lateral sclerosis or ALS, and patients suffer from the limited research funding and the common interest due to the small number of patients, and therefore there is no therapeutic treatment available. Let's explore the multidimensional burden of these diseases. The psychological and emotional toll on the patients is grave. The absence of cure fosters a hopelessness and anxiety. And studies show 60% of the patients with chronic disease experience clinical significant depression, often becoming worse by the unpredictability of the disease progression. Second is financial hardship. So we know that long-term treatments impose catastrophic costs. And in low-income countries, 50% of the chronic disease patients face poor disease management due to medical expenses. Even in high income settings, out of pocket costs for biologics or dialysis can exceed almost $30,000 annually. We know that in UK the treatment is available at free of cost to the patient, but actually it costs a lot to the government. And question is whether we can use alternative or complementary medicine in order to fill these gaps in the modern medicine. Let's talk about the social stigma and isolation. Due to the visible symptoms, for example, tremors in Parkinson's disease, or lifestyle restrictions, which include the dietary restrictions or limitations in chronic disease or Crohn's disease, often these lead to social marginalization and compounding emotional distress. The challenges in personalized medicine are a lot. While the genomic and precision medicine advancement still hold a promise, the application is very limited and only 5% of cancer patients benefit from the genetically targeted therapies, and biomarkers of the disease like fibromyalgia are still unidentified. The socio-economic and systemic barriers are also significant, and the disparity in the healthcare access disproportionately affect marginalized populations. And rural communities and the racial minorities often face delayed diagnosis and inadequate care with worsening outcomes. We are suggesting that there should be an acceleration of the translational research integrating artificial intelligence for drug repurposing and leveraging the CRISPR based gene editing, which could address the mechanistic gaps. Second is policy reforms. So, policy reforms, including government's pressure, must prioritize on funding for rare diseases and enforce the price caps on the essential medications. And third, and most important, is patient centered care models, including holistic approaches, including health the mental health support, the palliative care, and these are critical for removing the exacerbated suffering or minimizing the impact. The incurability of chronic disease thus underscore the systemic deficiencies in the medical system, particularly modern medicine, and addressing these gaps require a collaborative innovation, equitable policies, and renewed focus on the patient's dignity.